if Medicare is going to be paying providers at rates by which for every senior citizen walking in their door, walking to the hospital or the doctor's office, they lose money on each person, are they going to keep providing the benefit? And have you made calculations as to what that's going to do to the Medicare provider community with respect to whether they have negative margins, meaning bankruptcy, or not? And what are those projections, as you carry these numbers out?
Yes, you had several questions in there.
Yes, feel free to take your time.
First, regarding these comparisons, we assume that private health insurance payment rates to their doctors and their hospitals and so forth would continue to be negotiated in an open market pretty much the way they are now. And then we compare the Medicare rates, payment rates, to those for private health insurance. Because of the productivity adjustments and some other reductions in growth rates within the Affordable Care Act, for all the Part A providers, you get the pattern that you showed in the prior slide, and the figures you quoted were correct. And that assumes that, again, the private health insurance can't do something comparable to these mandated reductions in growth rates that are part of current law now for Medicare. In looking at those, it's pretty hard to imagine that they could be sustainable. Because when you think about it, the providers have to pay certain input cost increases. They have to pay their workers somewhat more next year than they do this year. They have to pay higher energy costs. They have medical supplies. They have rent or leases that go up. And they don't get a break from the energy company just because Medicare is paying them a lower payment update. They still have to pay all these input costs. So what we're paying them in the future is the growth in their input price, minus about 1.1%, representing the productivity gain in the economy overall. And that accumulates, as we've seen in these charts, to quite a bit of a difference. And that's why I've tried to raise concern about this and make sure that all of you are aware and you can monitor this and make sure that nothing bad happens. Because as you pointed out, Mr. Chairman, if at some point our payment rates to providers become less or significantly less than their cost of providing services, they either will be unwilling or unable to continue providing services. Now, before that happened, I think you all would have to act to override the productivity adjustments, much as you've had to do for the sustainable growth rate formula for physician payments. So I think that's the more likely scenario, but absent that, there could be very serious
what would your
problems.
projection be on the amount of providers unwilling or unable as time goes on, say 2030, 2050, as we go through this chart?
Well, we estimated, we did a simulation for hospitals, skilled nursing facilities, and home health agencies, looking at their actual cost report data and calculating that if everything else stays the same, just what would the impact of these slower provider payment updates have on their margins over time. And I'll confess I've forgotten the specific figures, but they're in our April 22nd memo that showed over, even within 10 years, a significant proportion of these providers would go from positive margins to negative margins solely as a result of these slower payment updates. And in the longer term, in the trustees report, it gets up to be over 40% of these providers would end up shifting to negative profit margins.
40%?
Yes, sir.